Good morning. Thank you for coming in at short notice. The Northern Territory is now facing its biggest threat since the COVID crisis began. The Security and Emergency Management Committee meeting has just finished. There are a lot of new developments that I need to update you on relating to the positive case from the Tanami Desert yesterday and some extremely important decisions that will affect many Territorians. There are a lot of numbers that we've gone through today. Some of these numbers overlap, some may be confusing. I'll do my best to keep this as simple as possible. There are also things that we still do not know, and I will get to that soon as well. I will start with the most serious news. There are 4 new positive cases. One case has since travelled to New South Wales, and we are advised about this from New South Wales Health, and they are managing that case. There are 2 new positive cases from the cohort currently isolating on the mine in the Tanami. These 2 people are now being evacuated to the Centre for National Resilience. And this morning, we received confirmation that one of the mine workers who had been identified as a close contact who lives in Palmerston has tested positive for COVID-19 while in the Centre for National Resilience. These are not considered community transmission, but they are cases of locally acquired transmission. The Palmerston case is a 64-year-old male who travelled by plane from the mine to Darwin on Friday the 25th of June. He was picked up by his wife and travelled straight home to Palmerston. His only other travel was to collect his adult daughter from her workplace. He did not leave the car. His wife and daughter had no additional movements. When interviewed yesterday as part of our contact tracing, he was isolating at home with his wife and daughter and reported to us that he had developed symptoms. He was immediately tested and taken to the Centre for National Resilience. This morning, we got the positive result. He will now stay at the Centre for National Resilience, and his wife and daughter are also being transported there for quarantine and testing. There were 80 other people on the plane with the individual. They are part of the 244 I talked about last night. They are now deemed high-risk contacts, all of them, and they are being in the process of contacted and transferred to the Centre for National Resilience, all of them. Last night, I told you of the 900 people that left the mine during the infectious period. 244 of those were still in the Territory. I will update you now on where we are with them. All who arrived in Alice Springs by flight or by road have been contacted, and all are in appropriate forms of isolation. Of the 211 who flew from the mine to Darwin, of which the positive case in Palmerston is 1, 196 have been contacted, 15 remain unaccounted for. There are 4 things that scare us. They are unacceptable to us at this point. First, there are 15 people that arrived in Darwin but remain unaccounted for. While we don't have their information, the safest thing to do is to assume the worst, assume they are positive, and assume that there are exposure sites. Second, of the people considered close contacts of the original case, as I told you about last night. 2 of those were contacted, agreed to isolate, but are now uncontactable. We are urgently tracking them down. But again, to be safe, we are assuming the worst. Third, everything we see points to this being the highly infectious Delta variant. Finally, we are expecting more cases, and we aren't expecting them to be as clear as the new case this morning. There is a much stronger chance that any new cases will have exposure sites, which makes the job of tracing and testing much bigger. So this morning, the Security and Emergency Management Committee of Cabinet made the decision to escalate our pandemic plan. I told you at the beginning of this crisis early last year that we would always do whatever it takes. We need to use the next few days to pause everything to buy us more time while we continue to test, trace and trap this virus. Here in the Territory, we do not have the luxury of waiting and seeing. If we wait and it gets worse, it will be too hard to control. So we are taking extreme action right now to stop or slow any spread before the coronavirus is let loose in the Territory. And that means we need a lockdown. Effective from 1 p.m. today. The Darwin, Palmerston and Darwin rural areas will enter a full lockdown for 48 hours. That means the local government areas of the City of Darwin, the city of Palmerston and Litchfield. This is what a lockdown will mean. If you live in these areas, you must stay at home, and you're only permitted to leave your home for the following 5 reasons. 1, medical treatment, including COVID testing or vaccination. 2, for essential goods and services like groceries. 3, for work that is considered essential. 4, for 1 hour of exercise a day with one other person or the people you live with no further than 5 kilometres from your home. And finally, to provide care and support to a family member or person who cannot support themselves. I cannot rule out the lockdown being longer. I cannot rule out expanding the boundaries of the lockdown. If it needs to be longer, if it needs to be wider, it will be. In addition to this, we are introducing a new direction on masks. For everyone in the lockdown area, if you leave your place of residence for one of the 5 reasons, you must wear a mask. Your ordinary place of residence is where you are now. If you own more than one house, your residence is the place you are now in. There will be interdiction points established to control travel in and out of these regions. The Territory Controller will say more on that in a moment. Territorians should not travel, including out of the Territory, unless it is for one of the 5 reasons. Non-Territorians are permitted to leave the Territory. If you are in the Territory and you have questions about how this works, we are setting up a new hotline. 1800 193 111. Say that again. 1800 193 111. They'll be there to help you. Questions like, what is essential work? What is an essential business? This hotline will be open from 1 p.m. We are making sure that all the staff are fully briefed on the directions so they can help you as best as they can. That is happening right now. They'll be ready by 1 p.m. As they can help you with your questions, I think it's critical we remember this general rule. If in doubt, stay home. If you're not sure, stay home. I ask that you be patient. We are surging up the people that will staff these phones to help you, but I am expecting more calls than public servants. And please, please be patient if you are purchasing essential goods. Our retail workers are frontline staff. Treat them with the same respect that you would treat a police officer. We have enough goods. We do not have supply issues. There is no need to panic about that. If you have symptoms, no matter where you are in the Territory, you are urged to get tested, to stay isolated until you receive a negative result. We will meet again later today and provide further updates as often as we can. This is a challenging time for the Territory and for all Territorians. As I said, it's our biggest threat yet. It's our biggest test. It's scary, it's uncertain, I know that. This is not something that we ever wanted to happen here. We didn't want it to happen. We've always planned and prepared for the chance that it could happen. We have tested this scenario over and over again. We will do the hard things now to stay safe. We know how infectious this can be. 1 case turns into 2, 2 into 4. We know what happens. I would rather regret us going too hard, too early, than go too easy and risk it all. We know how to beat this. We know how to do the hard things right now. Locking down, staying home. To stop this in its tracks. We will get through this. I'll pass now to the Chief Health Officer and then the Territory Controller.
Thank you, Chief Minister. So I said yesterday, this is now critical for everybody that is here to understand why these controls are in place. If I started by saying there have to be apologies for the impact on people, but it is for initially 48 hours. And this period of time is essential because now that we have a number of cases, and yes, we know who they are, and there'll be contact tracing of those individuals, which does take some time to determine where people, those persons have been positive, where they were, whether it be on aircraft or they've gone out and about in the community. So this is really important, that there will be potentially exposure sites that implicate others in the Territory, particularly in Darwin, but also Alice Springs. So you need to monitor our website. Most importantly, that provides a lot of other information, and the Chief has given the phone number that can give guidance about what people can do and also what are essential services and workers. This is not meant to provide hardship to others, so people who are out camping this weekend and are returning to the area described, they will be permitted to return home, and people who are coming here as tourists will have to stay within that boundary, and they won't be permitted to travel on. It is, we believe, the Delta variant, and I describe that because our local laboratory, which has tested a lot of positive cases, can detect a shadow of the Delta virus that they've detected on their the device they use from previous positive cases. The confirmation that will occur, but it's a precautionary approach, but we believe this is the Delta virus. So hence, highly transmissible, infectious. So the important thing is what the Chief Minister has just said. That is, this is critical for our community, so we don't see further spread within the community. We do not have community transmission, we've got an outbreak. But the determination of where infected persons have been will be shared with you, and importantly then you'll be contacted potentially that you have been in that site, and then need to have further conversations and maybe even quarantine. We hope that this will be for a short period of time, but this was part of our planning right from the beginning. For those who may not appreciate that this was part of the plan, to give us some time to actually put in place other controls and do that contact tracing. I want to thank again people who worked from the early hours of this morning until now, and we'll work through the day to put a whole lot of things in place, including communications about what's the current status and what will we be doing. But again, please be considerate. Follow the direction about not moving. It's to protect ourselves and those we love and care for, we share houses with, that it's designed to stop the spread of the virus and people not getting the virus and the potential for people being harmed. QR codes, again, I mentioned yesterday, don't just consider them as, oh, well, I don't need to use it when I go to the supermarket because I'm only going in there for 5 minutes. Please use it anyway. It's important because it helps with contact tracing. So again, this is absolutely critical for us. We've got a very large geographical area that we live in, and those who've come to visit us. At this stage, for clarity, there's no current implication for remote communities and sites, apart from this mine site. But this is an absolutely evolving situation, and that information will be updated as we learn more. Again, please be patient, look after yourselves, and I'm sorry to say it, but obey the rules. Thank you.
Good afternoon, everybody. The work has now commenced already for the activities we'll be putting in place to ensure that the residents and visitors within the Greater Darwin area are compliant with the directions that come into force from 1 p.m. We will have interdiction points on our major roadways to ensure that people are adhering to the directions. As it relates to anyone seeking to enter the Territory, and that's either by ferry, particularly from the Tiwi Islands, by charter flights from any of our remote communities, and the like, and our normal air travel into the Northern Territory. If you do not have a bona fide address already established that you will be able to comply with the directions, you will be refused entry into the Greater Darwin area at this point in time. Equally, by road, we'll be making sure that people are adhering to that. There are a number of people associated to the mine that have flown into Darwin in particular. There's 14 that remain outstanding where we have not been able to establish formal contact with. We have left messages with their relevant phone service, and as soon as they come back into range, we do understand a number of them are out camping and have not been in range at this point in time, but we're undertaking a litany of inquiries to try and identify their location and get in touch with them, and the road interdictions will certainly facilitate and enable that. The testing regime undertaken by our health authorities is well and truly underway, and results will continue to flow. What I do urge everybody is to adhere to the information that we have provided. Coronavirus.nt.gov.au is the website where you will get accurate information. Equally, if you like or follow the Secure NT social media pages, that will be your source of truth as it relates to information as it becomes available for us to put into the public domain. It is unfortunate, but a reality of living in the Northern Territory, that rumours and innuendo can awash very quickly. What I want to reassure all remote regional residents is there is currently no test that has returned positive within your remote communities. There is some social media indicating that that's the case. It is not the case. We will also ensure that there's a higher level of policing presence at our shopping centres and the like to ensure that people maintain calm. What's not appropriate is the whole family packs up and heads to the shopping centres post 1 p.m. today. A single individual from the family should be the one that goes and facilitates what you need as a family to see you through. As I mentioned yesterday, we have more than adequate supply chains. There is no need to panic. This is a 48-hour lockdown to ensure that we can identify the remaining 14 and minimise any, absolutely any potential of community transfer. We're in a fortunate position with our testing regime that we'll hopefully know the outcome of the tests in the very, very near future and understand, certainly from our jurisdictional colleagues, what other positive cases may have occurred from the travel that's been undertaken from the mine site. In respect to the mine itself, we have deployed the rapid response team. There's good interdiction that's occurred down there, lots of testing going on, appropriate separation and isolation, again for all of those that have travelled that we've established contact with. They've either been transported into an appropriate place of quarantine or in an appropriate place of isolation, and we have every confidence of that. We'll continue to ensure compliance in that regard. There will be many moving pieces as we go into this, but what we need to go back to is community adherence to the directions that are in place. These directions are in place to protect you, to protect your family, your friends. It is incumbent on all of us to adhere to it. If we do that, we may well be able to be through this far quicker than other jurisdictions have had to endure. So as a collective, I urge you all to stay calm, follow the information, follow your respected media outlets so that you are getting accurate and informed information, and simply stay at home and travel only if you meet those obligations as part of the exemptions. Thank you.
Can you explain the reasoning behind 48 hours and not the 3 days or 5 days or a week?
Yeah. We've had a lot of conversations during our scenario testing about the volume of testing and testing times and when results get in. And so for us, 72 hours is often based around your testing cycle. We've already been at this for 24 hours. And so that's part of the thinking. So 48 additional hours on top of what we've already been doing through the testing and isolation, we think gives us the information we need to be able to make more informed decisions. It might be that as we get through that 48 hours, we need to extend for longer, but at the moment we've been at this for 24 hours, so we believe this is 24 plus 48. So that gets you to 72.
And then obviously this might be a silly question, but obviously there's like middle markets tonight, it's the dry season, so there are weddings on, they're all effectively cancelled tonight. Yes.
We are working through a significant call list right now. As you can imagine, the workload from a decision like this is huge. I'm very, very mindful of the impact this is having on others. This was not a decision made lightly. We interrogated the numbers a lot this morning. It was a lengthy symposium to work through all the details to make sure we had absolute clarity of what we knew and what we didn't know. And as we really squared away the things that we didn't know, we made this decision reluctantly, but we know hard and early is better than late. And so we have made this decision now about locking down. I apologise to everyone out there who is impacted by this today. I understand that this is swift, that there has been maybe a little bit of notice because of what happened yesterday, but I understand that this is swift. But I've always said we'll do whatever it takes. We've talked about this a lot over the last 18 months, and those things will now be shutting down.
Which businesses are going to be closing? Which ones will be open?
So anything that's essentially deemed essential, so provision of essential goods and services, they'll be defined in the direction. I understand there'll be some people who want to ring up and ask for clarity. There can be grey areas in this, and we'll work through that with them on the hotline if they need that. We've got all our small business champions now engaging. We're talking to all the peaks of all the business organisations to work that through of all of them, so there's clarity about what can and can't open. But I think by and large this is common sense. You know, food is a very clear essential service. So those kinds of things are what we're considering will remain open based off, experiences interstate where this has come up, what is or isn't essential, I guess some FAQs, for want of a better word. Hardware stores are a deemed provision of essential goods for essential work. Alcohol's always been something that's highly debated. Down south, is it essential good or not? I absolutely understand that there can be debate about whether alcohol is an essential good. Alcohol stores will remain open on consultation with the police commissioner. Closing alcohol stores can lead to significant social order problems, which we don't want to have at this point in time. So those are the sorts of things that we have worked through with our direction and done in our scenario testing. If you are in doubt about whether your business is essential, call. But like anything, think about the 5 reasons you're allowed to leave the house. That's as simple as that. If you're one of the businesses that would cater for one of those 5 reasons, then that's the principle you should be applying. We're more than happy to work this through with you, but everything comes back to the 5 reasons that you're allowed to leave the home.
Gyms, I'm guessing.
No. You exercise for 1 hour a day with your friend or the people that are with you. That's outdoor exercise within 5 kilometres. Gyms won't be considered essential.
Childcare?
You are not allowed to leave the house unless it is to provide those essential goods. Childcare is covered in the direction as essential workers. So they're allowed to provide that care. So it goes back to the 5 reasons. You're not allowed to leave the house unless you're an essential worker. Childcare is considered to be an essential worker, but only children who should be at childcare are those children of essential workers. It all goes back to those 5 reasons. So if you're in doubt about any of this, track it back to the 5 reasons and look at it through that lens. I understand there'll be a lot of people out there now running those hypothetical scenarios. The hotline will be up from 1 o'clock, but all of it, if you go back to those 5 reasons for leaving the house, you'll see there's a logic to who and what is open.
Obviously, 48 hours, of course, we have to get through that to work out the rest of the week, but crack a night effectively on hold at this stage.
Will be a reward for good behaviour, hopefully. We've got a lot of work to do now. We are expecting there to be additional cases because we are treating this as the Delta variant, and on early testing we've got reason to believe it is the Delta variant. So we're treating this as the Delta situation. We know that's infectious. We've got those 4 additional cases already. The one that's currently in our care at Centre for National Resilience had an exceptional isolation record of no exposure sites. Outstanding. You can't hope that other cases that they come to light will have that same clean record and that same clear bill of health. So we will know more over the next 48 hours as we get cases, as we get exposure sites, as we work through that contact tracing. With the amount of additional people that entered the high risk category early this morning, with those 80 additional people off that flight, that expands out the significant amount of work we need to do around contact tracing, expands out the risk of there being cases, expands out all of that. So that's one reason why we've made the decision we have, and we're confident that the 48 hours allows us the time to do the work and allows us the time to get a greater degree of information from which to make additional decisions, either lifting or extending.
What about testing? Will you be providing more locations, extended hours for testing, that sort of thing?
At the moment, when you look at the numbers of people that we're dealing with, we're confident in the measures that we have in place for how we test them. There's a significant volume of testing that's already occurred. That's one reason why it's 48 hours as opposed to 72. We're now waiting for those results to keep coming back in, as we expect they will today. That question would be more significant as we get potentially exposure sites and the amount of people we test or need to test grows. So that's a situation we will deal with if and when it emerges. Testing capacity, testing locations, and how we provide that assistance to people to get tested. Right now, of the people that we know that we need to test, we've got it covered. If that number grows, which unfortunately under the Delta variant is a highly likely scenario, we will then make those other decisions.
And you're encouraging people to go get tested if they feel slightly sick. Are you confident that that will be met with the current locations and time?
Yeah. So that's the...
Just right, no worries.
Just so your eyes are looking.
Yep, okay.
And whoever talks, step to the front.
Yep, okay. We ready?
Yep.
Go for it. And we'll just get your name and title.
We can take that within the current testing regime. Thank you. Yeah.
So we understand that this original case, COVID case, reported in hotel quarantine in Brisbane, which they were forced into on their way to the NT. I guess is there frustration with the handling of that case by the Queensland government? Have there been conversations there?
I've been dealing with the situation we have here. I cast no aspersions in other states. I understand the decisions that they make. We had a difference of policy on that particular day. We reduced ours to Greater Melbourne. Queensland still had it for the whole of Victoria, and so that meant they went into a hotel quarantine instead of their booked accommodation, and they developed in that hotel quarantine site. I think we're all extremely mindful of the pressure every state has been under for 18 months. We understand the limitations of hotel quarantine. If anything, I have sympathy for other states as they work through their hotel procedures. We've had the benefit here of having excellent locations to work with. I know Alice Springs gets a lot of attention, but the top facility in Alice Springs is an outstanding facility too. We've been able to work with good facilities, with good processes, with good people over the 18 months. I understand other states have had significant levels of complexity to work with it as they apply their quarantine scenario. So I cast no judgment here. This virus is a tricky bugger, and we've got to do everything we can to test, trace and trap now here in the Territory. I've got nothing but sympathy for other states who have all done outstanding jobs when you look at Australia compared to the rest of the world. I know that we look at some of the things that we deal with, and in the Australian context are significant and serious, and what we're dealing with in the Territory right now is a huge threat. But compared to the rest of the world, Queensland has done just a remarkable job, and so I'm not here to criticise Anastasia or their government. This happened. We're dealing with it.
Does this show that hotel quarantine effectively does need to be scrapped immediately and finding another solution?
Hotel quarantine has dealt with massive volumes of people. There are problems that occur in hotel quarantine. That happens, but if you look at the incidence versus the volumes, it is still remarkably low. There is no better option to hotel quarantining that is available tomorrow, if that makes sense. There are better options available if you do a significant amount of work to set those better options up, but there is no alternative to be able to deal with the significant volumes that we have to as a country to be able to operate, to move. So I understand why hotel quarantining exists.
You mentioned obviously Territorians shouldn't leave the Territory, but non-residents can. So what's advice to people perhaps, booked on a plane at 1:10 this afternoon? So
we are talking obviously to the airport and the airlines, essentially EOCs doing that, so through the Territory Controller down through the Emergency Operations Centre. If you're a non-Territorian, you need to consider the directions in the state that you're choosing to go to. That's probably the most important thing. I assume all those states are adjusting their directions now. I can't advise you on what other states' directions are in terms of the declaration we're making today. They'll all be public soon, so be mindful of the direction of the state that you're going to. If you are in the Territory, for all Territorians, stay home. If you're a non-Territorian, we understand that you may want to stay exactly where you are, and that's okay. We're talking to all the hotels and motels about that as well. If you are a non-Territorian, obviously you can leave. That's the law of the land, and you can be mindful of direction in other states.
So are we effectively a hotspot, Darwin? Is that what, given we're in lockdown, is that the official declaration?
Well, there's many arguments about hotspot declarations. We declare other people hotspots. here it's a lockdown. Others may choose to declare us as a hotspot. I'll pass to Dr. Heggie to go through maybe the technicalities of that.
Just quickly, people who are hearing this message very concerned heading to the shops right now, what's your message to them for the next hour?
While this direction doesn't commence until 1 o'clock, our good behaviour can commence now. Please be respectful of everybody who you're going to meet at that place. As the Commissioner said earlier, this is not a time for expeditions. Don't take the whole family unit down. I understand people will be going to shop. You'll be allowed to do that after 1 o'clock. You'll be allowed to do that after 1 o'clock. So there is no need to panic buy. There is no need to rush. We have plenty of supplies and goods. We're confident in this. We've looked at our supply chains over 18 months now. We know that we have the supplies that you need. Be extremely respectful of frontline staff. So essentially, be respectful. Don't panic buy. You're going to be allowed to shop after 1 o'clock. There is no need to rush now. It's about having good behaviour though. Maintain your space. While the mask wasn't coming yet, be aware that's going to be coming in. And treat others well. I think that's a reasonable summary. I might pass Dr. Heggie then on that previous question around hotspots.
Thank you, Chief. And again, what's the principle that we're actually trying to achieve? It doesn't start at 1 o'clock. It starts right now with the information that's been provided. So it's not an opportunity for the whole family to go out to the supermarket or to the hardware shop. It's an opportunity for a person to do some shopping for some essential things that you need, because you are going to continue to be able to go shopping. It's not the opportunity to travel from one side of Darwin to the other side just for the journey rather than go to a local store. And really consider, what is the intent? The intent is to stop the spread of the virus, that we don't know what's circulating in our community at the moment. Just in regard to number one, testing, I think anybody who has symptoms, and I described them before, but they can be either none, but they also can be strange, like the loss of sense of smell or just a headache. Testing, we've got a partnership with the Commonwealth that's been helpful to allow respiratory clinics in our centres to be able to do non-symptomatic testing. So if people are concerned about potentially where they've been, take that opportunity. I will say that the principles that we talked about at the beginning of this journey and pandemic, when we used to talk about 15 minutes, we now know that with the variants of concern, particularly the Delta variant, where we saw a case in Sydney recently where there was 20 seconds of exposure where people were close together. So even right now, I think it'd be reasonable to consider wearing a mask right now, not after 1 o'clock. In regard to hotspots, I've tried to introduce a term through colleagues called geographical areas of risk, because that's really what we're talking about. Hotspots sometimes are used for different purposes, such as controlling movement or focusing testing, but geographical areas of risk, the other jurisdictions who understand what we're dealing with, and in a short while there'll be another meeting of the Australian Health Protection Principal Committee, which myself and Dr. Payne will be attending. They will want an update, and they may already be putting in place controls for their jurisdictions that could equate to what we've described as a lockdown, as a hotspot or a geographical area of risk.
Is one of the medical reasons to leave allowed to get vaccinated? Yeah.
So could you ask the question again?
One of the reasons to be able to leave home is to get a vaccine?
Yes, to be really, really clear. There was a lot of, I guess, I'll call it argy-bargy about whether I'm an essential worker or I'm going out for an essential service. So things like medical care, including immunisation, and not just for COVID-19. But there were a lot of people said, oh, well, you know, I do this or I do that. Really, we're talking about absolutely essential, and as you might appreciate, we already have a draft of this for this purpose, already written and to be enacted. So we're revising that list to look at those that are really that essential. And yes, obviously people may need to go and get fuel, people may need to go to the bank or the teller machine, but importantly, what's the purpose? The purpose is to restrict movement so that we have a chance of doing contact tracing and, importantly, not allowing the spread through the community just because people are just, oh, well, I'll try and do my exercise a bit further than 5 kilometres away.
Dr. Henry, can I just confirm, sorry, just going back to what I was speaking to the chief before, that this case was in hotel quarantine for just about 9 hours, quite close to someone with the Delta strain. Are you able to confirm that?
I am aware that there has been that strain within that quarantine hotel. When we talk about this, though, we're talking about not necessarily breaches of behaviour, but breaches of infection prevention. And now we know that sometimes even just, you know, some air that leaves a room with somebody who's positive can actually come out through the door and be on the floor or on objects that then somebody touches, which could be a door handle, it could be a lift button. We know that now. So it's not useful for us to go and blame. They'll be doing their own assessment. But this again reflects just how infectious this virus is now compared with before. And that's another reminder of what are the principles that we are doing to control it here. Already we've got a person who's travelled from the mine site through Brisbane and driven to a small town in northern New South Wales. So this virus has already spread to at least that site, and there may be more to come.
Last couple, please.
Just on the being able to leave your house for vaccines, currently you can't make bookings, but there are some places that are allowing walk-ins. Is this just for people who currently have bookings in place?
Look, I think what's really important is our vaccine implementation plan, entirely appropriate. It is designed to protect people who are most exposed and at risk. So that means clearly, as I said the other day, the cleaners in the Centre for National Resilience were the ones who got vaccinated first. They're people with chronic conditions or who are on certain medicines that compromise their immune system. This is not the time to suddenly rush out and try and get a walk-in vaccine. What we want are people who actually really need the vaccine at this stage.
Does that mean you could reconsider the eligibility that you have at the moment?
So say again?
Does that mean you would reconsider the eligibility you currently have?
Well, we're reviewing the eligibility, but it's mostly relates to supply. But mostly you need to consider, are you highly at risk at the moment? Because the best protection is not to be out and about. Or if you are, wearing a mask.
Thank you.
Thank you.
Hey guys, can you take a distance and wear masks?
I'm going to quickly call the teacher.